Good afternoon and welcome to our second day of the Caregiver Training Camp. My name is Rob Fabian and I am the Director of Marketing and Communications for Age of Central Texas. We are a regional nonprofit organization that serves older adults and family caregivers exactly like yourself. And so we are very happy that you are joining us today for this wonderful presentation. It is number 2 of 4 presentations that are part of the training camp. And we are so glad that you're here because we have some incredible information that we're going to share with you today. Before we get started, I want to share with you a video from our friends over at Baylor Scott & White. Give me just a moment because it seems to have just disappeared off of my computer. So we're going to share this with you.
At Baylor Scott & White Health, there's nothing more important to us than your well-being. Over the last several weeks, we've done a number of modifications to our emergency room so you can continue to get the care you need when you need it. We're regularly cleaning and disinfecting frequently touched surfaces in our lobbies and patient areas. When you arrive, a screener will check your temperature, and we're requiring everyone to wear masks. When it comes to registration, we've got a no-touch process. You'll just answer a few simple questions. We'll get you back to our room as quickly as possible. We want you to be well informed and not ignore symptoms that could indicate a potentially serious condition. In those situations, it's critical you don't delay. To learn more about all we're doing to help keep you safe, visit bswhealth.com/safecare.
We want to thank Baylor Scott & White Health for being our sponsor for this year's training camp. And we want to thank all of our sponsors who help us bring this together so that we can present it to you for free this year. So a couple of quick housekeeping items. If we have some tech issues along the way, don't worry. We are recording today's session and we're going to be posting it on the Age of Central Texas YouTube channel. We'll be sending you the link at the end of the conference to all of the sessions for this week, along with, once again, sending you all of the caregiver resources and the program and all of the other materials. So you'll have that all in one spot so you can go back later and take a look at the videos. You can share them with friends and be able to reference them after the fact. I mentioned that we have sent you the program. Be sure and take a look at that. It has lots of great information about all of our presenters and about our sponsors. There's also some caregiver resources that we provided for you that has lots of great information. And of course, we're going to be sending you the Caregiver Playbook, which will be our Friday session that has tremendous amount of information on resources here in the area. We're also at the end of the session going to be sending you a survey, and we ask that you just take a couple of minutes to fill that out. You can do it electronically, and it'll only take you about 2 minutes. But that information is very helpful for us because we need to know, as a caregiver, what are some of the issues that you are having that we did not cover during this week so that we can improve this caregiver training camp and add those issues that are affecting you so that we can cover them in future training camps. Also, we do a number of other caregiver conferences throughout the year. So having that information helps guide us as we're looking for speakers. So we want to make sure that we're bringing you the best information that we can, because after all, this is for you. This is your information and your time to learn and to ask your questions. Speaking of asking questions, if you look right down here, you have a chat feature. If you click on it, it opens up your chat box. The little icon looks kind of like one of those thought bubbles from the cartoons. Click on that and type in your questions today, because we want to be able to provide you with all the information that you need. So at the end of today's presentation, we're going to have a facilitated question and answer session, and we are going to answer all of your questions. Now, we are a little bit limited on time. We said that we were going to go for an hour and a half, and we are going to honor that time for you because we want to respect your time. So if for some reason we don't get to every single question today, don't worry. We are still going to answer your questions. We will send you a direct email and answer you directly. But this, again, is your opportunity to ask those questions about your caregiving journey while we have the experts here to help you out. Speaking of experts, it is my pleasure to introduce Lina Supnet-Zapata. She is one of our amazing go-to speakers here at Age of Central Texas because she has such a wealth of knowledge. She has 25 years experience in healthcare, and 10 of those years were in hospice care. And in 2013, she joined her mother-in-law, Frances MIR, to oversee the operations of MIR Care Consultants. And they provide in-home care for folks throughout all of Central Texas. And as the vice president of MIR Senior Care Consultants, Lina advocates for pre-planning for healthcare. She helps her clients and her families maintain a control of their choices through this caregiving process and the aging process. So she has a wealth of knowledge when it comes to today's topic. We're going to talk about medical management. As we know, so many of us, our older loved ones, have more than one doctor. And a lot of times those doctors are not talking to each other. And so we've got a lot of prescriptions that we're having to juggle. Plus, just so many other medical issues that come along with aging that we as caregivers have to help navigate. And a lot of times we're not prepared for that. So it is my pleasure to introduce Lina. And Lina, I'm going to let you take it away and talk to us about how do we keep our loved ones healthy.
Yeah. Great. Thank you, Rob, for that introduction. Greetings from Austin, Texas. I don't know where our viewers are coming from, but I'm so grateful that you're here today. I'm going to go over some medical issues, but I did want to be able to share my screen here. So if you give me just a moment. And okay, great. Hope everybody can see that. I'm sure I'll see in the chat if you cannot. So today I'm going to talk to you about tackling medical issues. And from a personal perspective, I am currently a caregiver. I care for my mom, who is 82 years old and has dementia with a Parkinson's diagnosis. And I have been taking care of her hands-on for the last 4 years. Prior to that, I was a caregiver for my dad in his 363-day journey of his diagnosis of non-Hodgkin's lymphoma. And so even though I'm in the field of care management, I'm a daughter first, and I had to learn a lot just by experiencing being a caregiver, but also from the perspective and the professional perspective as a certified geriatric care manager. I've seen a lot of what my families are faced with, and there's a lot of commonality with that. So I'm really glad that I get the opportunity to share some personal experience, but also peppered with some of my professional experiences and how we've been able to help and guide families during this very honorable but very challenging journey of caregiving. During the pandemic, we did see a lot of issues that came to many of our families, adult children who are in the caregiving role, maybe not hands-on, maybe not as intense, but the pandemic really put us in a very challenging position where we did have to suddenly jump into being a caregiver. And to be frank, a lot of us were not prepared. A lot of my families, a lot of my adult children that we work with were not prepared for the journey. And it became very glaringly clear that we all need to have this repetitive communication and education, which AGE does a wonderful job with, in being prepared as much as possible for the caregiving journey. So there are 3 scenarios that I'm going to go over that I think are very, very important. And that is, the first one is not being prepared, conversation, dialogue, and just knowing what to have in place in the event that an emergency arises. The other one is appropriate medication management. We'll go into some depth on appropriate medication management and how we can avoid what's called polypharmacy, which I will define and break it down for our viewers. And then preparing for a hospital discharge. Perhaps some of you have been there, and it can be a very chaotic, unpredictable experience. And usually sometimes it's just happening on a Friday and they call you and say, okay, we're ready to send mom or dad home, which in a crisis situation, going into and then leaving the hospital in kind of crisis mode is not an optimal way to care for our aging parents or relative. So the first agenda, the first scenario is a parent needs to go to the hospital for an emergency situation. What do you need? So this is what I call the book. And I had two books, one for each of my parents and I still do. And this book is very, very helpful. There are many variations. There's variations on what you can put into this binder, but I think in any event, in any scenario, if you're caring for somebody, whether it's an aging loved one or a child, you need to have this information available. And the book will include legal documents. So that would be your financial and medical power of attorney. The medical power of attorney, I think, is, because we're looking at healthcare scenarios, that the medical power of attorney needs to be included in this book more so than the financial. Any directives to physicians, a DNR, which I will go over specifically because oftentimes individuals get it confused with a directive to physician, and it's a totally separate document. Insurance cards, whether that should be your primary, the Medicare card, any supplemental cards, dental cards, identification cards, your prescription cards, all of those things should be copied. And especially if you are a veteran, and the military ID would also be helpful to have in that book. I don't suggest putting I put Social Security in there, but now that we are in such, there's such exposure to fraud, I would remove that and just kind of keep it handy if they ask for it. The most recent medication list is also very important to have. That includes over-the-counter medication, any herbal supplements that your loved one is taking, provider information. Provider information is any specialist, primary care, physicians that are involved in the elder adult's care. Family contacts, those are very important in order of who is accessible. It would be the primary contact, who is the responsible party, and then any relatives, siblings or spouses or a spouse coming that are also involved in care. The next one is the HIPAA release. And a lot of times people don't have the formal HIPAA release, but if you engage with an attorney, they can provide that for you, or simply a letter authorizing and making a blank for that specific entity that you are releasing the information and that you are permitting that person to speak on behalf of your elder loved one. Life insurance policies or long-term care policies. Long-term care policies are very important to have. You don't necessarily need to bring those to a hospital setting or a clinic setting, but it's good to have and to house it in one place. Any information on final arrangements, burial, and any specific wishes should also be included. Important phone numbers, whether that be the pharmacy, your durable medical equipment, home health, hospice care, those should also be inserted. And then your pharmacy, and we'll talk about the importance of knowing who your pharmacist and your pharmacy provider in later on in the presentation. Okay, so I talked about a DNR. This is really important for those of you that are residing in the state of Texas. This is a Texas specific form. It's called the Out of Hospital Do Not Resuscitate form. And it has, and I'm sorry, it's a little blurry here. It didn't take off too well, but it has the little logo of the state of Texas. And so this is how you know that it is the right form. This allows patients to direct healthcare professionals in the out-of-hospital setting to withhold or withdraw specific life-sustaining treatments in the event of a respiratory or cardiac event. So if you do not have this accessible and first responders, EMS come to the home, they will perform CPR and they will do chest compressions. So if the elder adult, the wish is not to be resuscitated, it's helpful to have this form and it's helpful to have it accessible. Many people put it at the bedside, or they tape it to the front door and back of the front door. Or from my last presentation, I was informed that they put it in the freezer because it is fireproof. So those are areas that you can keep this DNR. The DNR can be found online. You just type in a Google search, Texas out of hospital DNR, and this will come up. It needs to be signed by 2 witnesses in 2 different places, and it also needs to be signed by your physician. Medical providers are very familiar with this form. You just need to ensure that somebody reviews it, perhaps a medical social worker within the practice, that can review and make sure that it's signed in the appropriate places, because there are 2 designated areas where the witnesses and the medical provider need to sign. So I stress this is very important to have. It's not mandatory, but if the wish is not to be resuscitated and to have no heroic measures, this form is very important to have in place. Okay, the next area that I think needs to be covered is being prepared for sudden hospital visits. And I saw this a lot with many of our clients who had to go to the hospital because of COVID-related issues. And the hospital trips happened quite suddenly. They were having respiratory issues, high fever, and they needed to go to the hospital. It can be incredibly stressful. If some of you have gone through this, you know how stressful it can be, and you feel like you're out of control. But there's one thing you can control, and it's what you put in this essential to-go bag, this hospital bag. You know, pregnant women, when they're about to deliver, they have that bag ready. I suggest it for sudden emergency hospital visits to have and to keep keep by the front door or somewhere, perhaps in the trunk of your car. This is just something to assemble ahead of time, just in case. Put some of those important documents, copies of those important documents, into the bag, and a few other necessities. Preparing helps you, it helps you to prepare for the emergency, but it also can alleviate a lot of stress during what is a very stressful time. If there's a crisis, you just grab the bag, your essentials kit, and go to the hospital, and you can feel a little bit more confident that you have what you need to take care of not only the elder adult, but also for yourself. So what do we put in this bag? So the insurance cards, copies of the insurance card, ID or driver's license. Again, you should make copies and not the originals. The living will, an advance directive, information on a healthcare proxy or a medical power of attorney. You should also have that DNR in there, and any personal information such as it relates to medical care. So current height and weight, current list of medications. Again, that means also supplements and any over-the-counter medication, the dosage and the schedule of those medications, notes about allergies, and medications that have caused negative reactions, a brief medical history. And, you know, I referred to the book. It's also a good idea to keep a notebook as you care for your elder relative, to just document certain things that might have happened that, you know, are of concern, or just to keep a mental note. Because I don't know about you, but for me, if I'm trying to recall things about, you know, my mom or my dad, and trying to recollect in a stressful situation, I'm not going to remember it, and more than likely I will forget to include something. So it's just really good to have that historical reference so that you can refer to it when you are at the hospital, because they will ask you about history. Don't count on the hospitals, unfortunately, to have the information on hand. We've had many times where one of our clients went to the hospital and they just have the demographic information, but a lot of these other details they didn't have. You would think that they might have it on file, but I would just be proactive and make sure that you have this in the bag. So You are more than likely going to accompany your elder relative to the hospital. Unfortunately, during COVID, a lot of people could not accompany their elderly loved ones. So in addition to what I have mentioned for your elder relative, I would also include some maybe a photo or two to kind of just personalize the room so that they're not by themselves. Also, of course, extra clothing, you would want to have that with them as well, and some personal care items, because many people just went with what they had on their body and then they went to the hospital. So what to bring for yourself? You'll probably be spending a lot of time waiting to hear from the providers. The admission time can be a little bit lengthy. So you should have some things in place for yourself. And so this is what I suggest. A list of important numbers. If you are not a techie person, have that written down in a notebook somewhere. Comfortable clothes and shoes for yourself. Reading glasses. I tend to lose them all the time, so an extra pair would be great to have in that bag. A phone charger or two. It's not nothing worse than having to run out of batteries when you are stuck in the hospital. So keeping a couple of chargers with you, a pen and notebook to jot down notes, something to keep you entertained, perhaps books, iPad, puzzles, some snacks. A lot of times, the cafeterias, especially during COVID time, were not open. So good to have a little bit of sustenance and put in that bag. Earplugs or eye masks, especially if you're going to spend the night. It's good to have that in place, as well as some earphones so that you can listen to your tech devices. And then, believe it or not, small bills and change for the vending machine. I mean, we don't think about these things, but it's very, if you're starving, you're going to take anything. So it's good to have some change with you to get that food that you need. Okay, the next scenario that I'm going to go over and that Rob had mentioned earlier is that mom has 4 doctors and they all prescribe different medications. And so I'm going to go over effective medication management. Now, I just had a recent encounter. I had a client who had seen 2 different providers. One of them was his regular provider. The other one was a new provider. And the pharmacist actually caught the 2 medications that were prescribed, one by the new provider, one by the old provider, and that actually would have had a negative consequence had he taken these 2 medications together. So again, I'm going to go over, one of the reasons why you should have a good relationship with your pharmacist. And that was just a real life scenario that happened and could have been a very negative consequence had the pharmacist not caught that error. Okay, so I talked about polypharmacy, and polypharmacy is the concurrent use of multiple medications by a patient to treat usually coexisting conditions, and which may result in adverse drug reactions. Adults over 65 are more likely to use a combination of prescription medications and over-the-counter medications to treat multiple conditions. They are also more likely to experience harmful side effects from medication due to changes that occur with aging. This increase in medication can lead to harmful side effects and interaction between drugs, and oftentimes rehospitalizations within 30 days of discharge. Approximately 40% of older adults take 5 to 9 medications, and approximately 18% of older adults take 10 or more medications. I know this to be true because this was my dad, and it is also the current regimen of my mom. Okay, just a few little statistics for you. Older adults visit the emergency department almost 450,000 times each year, more than twice as often as younger persons. Adverse drug events cause approximately 1.3 million emergency department visits each year, and about 350,000 patients each year need to be hospitalized for further treatment after emergency visits due to adverse drug events. Medication mistakes cause at least one death every day in the country and injure, like it said here, 1.3 million every year, according to the US Food and Drug Administrations. People age 65 and older are especially vulnerable to medication errors. And this is from the CDC.org. Okay, so I don't know if this looks familiar. I'm going to move my my screen here. If this looks familiar, but this is sometimes what we walk into when we are first assessing a client and looking at their medications. It is one of the top things that I review when I'm meeting with clients. And so you can see kind of the chaos and mess here, and how could you appropriately manage this situation here. So the first thing for appropriate medication management is to gather and organize. This may look familiar to you. It's a good idea to gather all medications, and that means all medications, over-the-counter vitamins, herbal supplements, drops, eye drops, and get them into one location. To stay organized and increase medication safety, keep all the current pill bottles and packages in a clear plastic storage bin. Do not take them out of their original container. I have some clients that, for whatever reason, like and organize them in their own little clear bins or clear medication bottles, but that can lead to a lot of confusion and a lot of errors. And it also to use a separate bin for their backup medication supply or medicines that are only used occasionally. So occasionally means if you see PRN, they're not in the routine medication regimen, it's good to keep those separate. And then if there is backup medication, so those instances are when you are going on vacation, or you're going on a short trip, to have those, or if there's an emergency situation and you just need to go, it's good to have those also in another reason why it's good to have those in a separate location and bin. So you might notice that some elder adults might keep their certain pills in the kitchen, some on the bedside table, some in the bathroom medicine cabinet. So again, it's really good to put those all together. I would also recommend that storing, or if they're in the bathroom, if they are stored in the bathroom, that is not a good place to keep medications because it's humid, and most medications require just a cool place to be stored. So if they are in the bathroom, it would be recommended to take them out of the bathroom because, you know, showers create steam and it could really impact I'm losing the word, but it could make the makeup of the medication, it could alter the strength of the medication and actually make it kind of soft and mushy. I don't know if you've ever seen that before, but that would be recommended. So the next way to track your medications, and this is a source from AARP. It's very simple to use and it can be printed out. You can make several copies and you can either write in pencil or redo it. But it's easily accessible, but it has your medication list. It's a medication record. And this can also be inserted in the book, and a copy can also be put in the bag, your emergency bag that I had mentioned. So to prevent negative drug interactions, it's essential to know exactly what medications your elder relative is taking. Again, repeating that this includes all of their vitamins, supplements, herbal supplements, and over-the-counter medications, in addition to their regular prescribed medications. Names of the prescription medication and all of the other items that I had mentioned should be listed. It's going to ask about how often each time the medication is taken, what dosage is given, who prescribed the medication, and the purpose of that medication, and whether this is just a short use medication or is it a long-term use medication? And again, repeat and over communicate. And anybody else that's involved in the care should also be privy to this medication list. So if you are working with your sibling or another relative, they should also be apprised of the medications that the elder adult is taking. So I'm going to go over some good tips for medication management, and then I'll go into a little bit about the different dispensers, and then some more tips in addition to what I have added here. So some good tips for medication management. Again, we're trying to avoid polypharmacy, and medication management plays a vital part in managing a health condition. Missed doses or improper use can be really harmful. I speak from experience. Compliance is a big thing for elder adults. A lot of times, like my own personal experience, my mom would just say, I'm not going to take it. And then she would stop taking it and then not tell anybody. And then we would notice some behavior issues or, just differences in her overall behavior or health, and come to find out that she wasn't taking medications. So regardless if you have a good list, it's also to make sure that the elder adult is taking their medication. And as a caregiver, that's really one of the most important roles. Our elder adult is to make sure that medications are being ordered, that they're being taken, and they're being taken appropriately. So the first tip for good medication management is to invest in a pill box or dispenser. Though it's a common solution, many people begin medication regimens without thinking that they need a pill box. For example, I have clients that put them in a dish, and they put each one in a dish. It's not dosed. It's not for any particular time of day. They just know that they need to take the medication. So they have it like in a little candy dish, and then they just take it when they think they need to take it. That's very dangerous, and it's also can cause very harmful effects. So the pill box, as you know, you can buy them at Walgreens or CVS, your local pharmacy. They're boxed usually from Monday through Sunday. And they have 7 compartments for 7 days of the week. Some may have 30 to 31 compartments. As you can see the picture here, to cover an entire month if you so choose. One way that we like to manage medications is to buy several of these pill boxes and fill two weeks at a time. That allows for them not to have to worry about setting up the pill box every week. Every 2 weeks is kind of a good way to manage medications and make sure that they're set up appropriately and that they're taking them accordingly. They're also a good way to keep pills organized. And then it can also tell you that it'll be a cue to know when it's time to refill the prescriptions. The next one is to set reminders. This is where compliance comes in, and a lot of times our elder adults can't remember, so they think that putting it in a candy dish is the best way, but you can actually help by setting up alarms. If they have a technical device, you can set one for yourself so that you can cue and call or remind if you are in the household with your elder adult to remind them, or you can set up reminders on their phone or buy an alarm clock and set up those reminders through that device. The next one is to use a single pharmacy. I cited an example in the beginning. It can be really easy your provider that it could be easy to drop into the nearest drugstore after a doctor's appointment and get all your prescriptions filled there. However, it would be a good idea to have all of your medications transferred to your pharmacy and get to know your pharmacist and the pharmacy tech that is at the Walgreens, HEB, or wherever your pharmacy may be. Getting to know them, they understand your health history. They keep an electronic record of all of your information, all of the medications that you've taken, and it's much easier for them to spot a red flag with a combination of drugs that might cause a problem for you, in the case that I had cited earlier. By getting to know the pharmacist, know that, you know what, this is not good, they'll call you, or they will even talk to you while you're there picking up your prescriptions and getting them filled to inform you. And they will also take it a step further to call your provider and let them know that this combination of drugs is not going to work. So make a different recommendation. Again, I had mentioned storing your medications properly and taking them as recommended. They have storage instructions. Sometimes we don't read them. Again, it's not really a good idea to keep them in the bathroom because it's a moist environment. So sit in a temperature is the best, and also look out for medications that may need to be refrigerated, that you're keeping those refrigerated, if that's what the instructions tell you to do. The living room or the bedroom where your elder adult is most likely to frequent is also a good place to store medications. Now, if there are class 3 narcotics involved, it's good to keep those in a separate area and perhaps in a lockbox. I mention this because sometimes you have caregivers that are from the outside, or people doing repairs, or we've seen it all. It's just good to make sure that those are in a safe place so that it can avoid anybody taking that medication, and that it's not intended for them. Okay, the next one is to review your medications regularly. I do this probably around springtime with my mom's medication. It's just a good idea to make sure that the medications that she's needing are necessary. Are there drugs that she should not be taking anymore? Could there be 2 medications on there that could be a dangerous combination? Is she having any side effects? So I kind of do this I do this assessment. I get the medication administration record from her assisted living, and I go over it with the provider just to make sure that we're on track. I don't want her taking any medications that are not necessary. It's just one more pill to take. And, she's already on, 10 plus, as I had mentioned, medications. So it's just good to, if we can pare it down, that's great. If not, at least you've done the spring cleaning of the medication regimen that is prescribed for your elder adult. Okay, so I talked about medication management systems. There are a dozen out there, but these are the ones that I've seen that have worked for some of our clients, and they're automatic pill dispensers. Again, we talked about compliance. How can I have mom or dad remember to take their medication? And so there's 2 here that I have listed. Again, I have no affiliation. I just know that my clients have used these medication dispensers. The first one, it's locked. You can put 28 doses in there. You can set an alarm. It has a reminder up to 4 times a day, and it'll dispense the medication that is prescribed. And it's easy. It's a non-intrusive beeping. It's not a loud, scary beep, and it's gentle. So it's easy to load, and it's easy to use, and it's locked. So there's really no chance of taking a pill by mistake or double dosing. The other one, which you can just see the bottom, this is kind of the Mac Daddy of medication management systems. It holds up to 10 different kinds of medication. It can dispense them multiple times per day. There is a membership fee. It's called the Hero. That's the name of the dispenser. It has an integrated app, and it has a medication refill service, and then 24/7 support. That's super fancy, but it works for some folks. Okay, these are things that you can get. Either the first one here is the blister pack. Your pharmacy, for an extra charge, can actually put medications into a blister pack, and then you just have to pop it out. Sometimes people feel that this is easy. It comes like in it's a cardboard with the instructions, and then a 30-day supply for each card. The other one that was is gaining popularity is called the Pill Pack, and that's an Amazon company. This has been really convenient. It comes in a strip, and it has it divided by the times of the day and then by day. So you can see here it has 6 p.m., 1 p.m., 8 a.m. It has everything that's listed for that particular time, all the medications that need to be taken. And then lastly, this is a more common one. It's a little bit fancier than just the regular plastic pill dispenser. This has an alarm. It's 2 weeks worth, and it's a step up, but I think it does the trick. And then if you're trying to get into another day, it's going to beep an alarm like that's not the day that you're supposed to take that medication. So I think it does the job for what it needs to do. And all of these can be the blister pack, and then this fancier pill dispenser can be found at your local pharmacy. And then you would just need to go to pillpack.com if you're interested in the pill pack method of medication administration. Okay. And then there's mail order. Of course, if you have Medicare Part D, you can get a few prescriptions mailed to you. Many of the pharmacies, including HEB, now do delivery. So that's also if you have a homebound relative, or especially in the time of COVID where people weren't really going out, this is a safe way to get your medications. And oftentimes they will do it by 90-day refills. So the next scenario is the discharge planning. Dad or mom is discharged to home, and what do I do? Over the course of my years in hospice and in care management, I have seen so many discharge plans that have caused so much stress. And it's because even though the plan is to have a organized discharge, it oftentimes doesn't turn out that way. So I try to empower our clients, our adult children who are taking care of their parents, to you need to initiate and start the process. And so what are the things that you need to have in place, and what do you need to do? So you know that a trip to the hospital can be intimidating, and a very intimidating, scary event for clients, your elder adult, family member, and of course you as a caregiver. So you are completely focused on getting the help that your family member needs for medical treatment, right? And so is the hospital staff. So you might not really be giving much thought to what happens when they need to leave the hospital. So the way that the transition is handled, in my opinion, I think it's just a lot of people are working towards the same goal, but sometimes the communication cannot be there. So again, I put the empowerment to the caregiver or whoever is taking care of the elder adult to ensure that you have a good, smooth transition to wherever your adult elder is going. So the best time to start planning for the discharge is just after your family member has been admitted. While it may seem too soon to think about going home, planning gives you more time to prepare. And I'm always talking about preparation and pre-planning. It's really important that you do this in the hospital setting. What we found too is that sometimes on a Friday, they're calling you and saying, okay, we're going to discharge mom or dad home. And that, again, is a crisis situation, leaving the hospital, and it can really cause a lot of panic. So I'm going to give you some tips on questions and things to think about as you start the discharge planning back home. So the first thing is know who is on the discharge team. There are several people that are involved, and one of them is the physician. There's also usually a social worker and or an RN case manager that is involved in the discharge planning. So when you're getting ready to go home, it's good to start talking to these people or finding out who these people are, these key players in the discharge planning, who they are. You can ask the unit clerk or the nurse who these individuals are, and they should be able to give that to you. Now, I do know that when somebody is admitted, that they do assign someone, but that time that from the admission to assigning the case manager or the social worker, that there might be a lag time there. So it's just good to be proactive in asking who those individuals are. And you can ask for their extension or where their office is. So I have no problem knocking on their door or giving them a call and asking them ahead of time what the discharge plan is going to be. Now, they may not know at the time of admission, but having regular check-ins to see if there's been any changes is good to is a good practice. And also just know that that you're there as the caregiver and that you're wanting to make sure that the discharge home is going to be as seamless as possible. So we're ready to go home. What do we need to do? You need to ensure that any equipment or supplies that are needed are in place. And that means if they're coming home and they need a hospital bed, for example, if they're coming home with hospice, is there room to put a hospital bed in there? Is there room for if they need oxygen? Is there room for that? Is there adequate outlets to plug in the O2 concentrator to dispense the oxygen? So you just want to make sure that the space is clear to wherever they're coming to. If they need supplies, for example, if they have wound care and they need, if there's special items, bandages, ointments, those types of things, do you have those all ordered and ready to go? And are they there ready to receive your elder adult when they do come home? The home space, you need to make sure that it is adequate as far as from a safety perspective. Are all rugs pulled up? Is there enough lighting? Is there enough outlets again for electronic equipment that might be necessary? Is the bathroom safe? Removing the rugs. Do you have a shower chair in there? And making sure that is there a phone that needs to be placed near the bedside? I also like to include maybe a little bit of a whiteboard, or a little whiteboard in the room, so that you can write just what day it is, or important information that perhaps if caregivers are supplementing care in the home, that they have that as a reference. And also the book should be also in that space, or the notebook that I had referenced, so that people can document any differences in health, any behavioral issues, anything like that, so that you have a historical reference to the care when they come home. So the other thing is healthcare tasks. Now, there's no harm in saying that you can't do something, or that you're not equipped to, or you just don't have the bandwidth to do it. It's good to be very honest on your abilities, on what you're able to do. I have some clients that will not or cannot change a brief, and that's okay. This is, you can do what you can do. But if you're willing to, it's a good idea to ask staff, or the RN case manager, or the social worker, those that are involved in your discharge planning, to ask them, how do I do this? How can I feel confident in knowing that I'm doing it right? Can you teach me? The hospitals wants you to have a safe discharge, but you have to be open in what you're able to do, because we want you to be set up for success when you come home. So ensure that you're able to do the tasks. If your elder relative has been going through rehab and they have to transfer from the bed to the chair, are you physically able to do that? You should ask, I need to learn how to do that, because we need to also ensure your safety as a caregiver to make sure that you don't pull out your back or you don't hurt your knees in providing that type of care for your loved one. And it's okay, they're there to help you. So ask the questions if you're unsure of doing any of those specific tasks. Special foods or dietary changes. Now, sometimes when they come out of the hospital, they're going to require different foods, maybe soft mechanical diet, just soft foods, maybe avoiding dairy. So it's good for you to ask if there is a dietitian that has come to visit, or again, turn to this discharge team and ask them, any dietary changes, what do I need to prepare for? I think in this day and age, it's really great that now you have all of these food delivery. So you can actually put your list together while you're at the hospital and get those changes or needs sent to the home in time for when you all arrive home. Again, medication management, we talked about that in detail, and it's very important to know what medications have been ordered upon discharge, and to make sure that that's communicated with the providers that are involved in the care post-discharge. Oftentimes this is where we see a lot of confusion, and then polypharmacy happens because you've got your medication regimen at home, and then you have new medications that are introduced while you were in the hospital that they have to take. So it's a really good idea to talk to your pharmacist, but also make sure that the primary care and any providers that you're seeing after the discharge know about the medications that have been added to what is already being taken. And then the follow-up appointments. This is really important. Again, your family member may have one or more new healthcare providers involved in the care. You have your primary care physician, but maybe they'll say you need to follow up with a cardiologist or a neurologist. So again, you'll have to make sure that those appointments are made in a timely manner, but also communicate all of those changes to your primary care physician, who I look to as the hub of all your medical care. But unfortunately, as much as we would like it to happen in a perfect world for all of our providers to talk to each other, it just doesn't happen yet. So it's up to you as the caregiver or the relative to make sure that they know who the follow-up appointments are with, who the new providers are that are introduced to care, and then also the medications that have also been introduced. So this is a great checklist that you can find on Medicare.gov. You can staple extra pieces of paper on there to write additional notes, but this is a discharge planning checklist that Medicare has provided. You can print them, and it has a lot of good information on the different areas: care after discharge, your health, recovery and support, and then for the caregiver. And then it also has new medications. The fourth page has new medications and follow-up appointments. So everything that I just discussed here, this little resource checklist has it compiled all together for you, so you can just go down the list and check off what's been done. And then it also has a resource page that has a lot of national resources, and then of course our hosts who do so much for our local community. They have so many resources. Our caregivers and family members may often feel isolated, but if you're looking for information, education, ideas of understanding the aging process, AGE is a really good place. They have a wonderful resource center. They're local. I've listed their phone number here, along with their very robust website of information for you to reference. And then most importantly, caregivers out there, you need to be able to take care of yourself. And I know it's really easy to say, but being a caregiver is a big job, whether your family member is in the hospital or getting ready to go home. You need to take care of yourself, not just your family member, because a lot of times the caregiver is the only person that is there for the ailing elder adult. And so if you're not taking care of yourself, then they won't have anyone to take care of them. So it means paying deliberate, and I say deliberate, attention to your feelings as well as your physical health. It also means taking time for yourself, even if it's just for a short half hour, just to get out in the sunshine, take a walk, do some physical activity, but treat yourself well, because this is, sometimes it's a marathon, and on this journey. So this is the end of my presentation. I thank you very much for listening, and we'll turn it over to questions. And I hope you all have a good day.
Thank you so much, Lina. I'm going to let you unshare your screen. And while you're doing that, just a couple of quick things to point out for everybody who is viewing this. Number one, reminder that we are recording all of these videos. So if for any reason you had to pop off and you want to watch the rest of it later, or you missed any of them during this week, we're going to send you a link at the end of the conference that'll have a link to not only all of the videos that have been recorded, but all of the materials as well. So like that wonderful list that Lina had of resources, we're going to send you a PDF of her PowerPoint so that you'll be able to go back and look at those later. Also, you talked about self-care, and that is something that we discussed at length yesterday in our session with Lori Hill about I'm a caregiver, now what? And so if you missed that session, it'll be up on YouTube very shortly. And there's some great information, great tips and hints on how you can take care of yourself. Because as Lina said, a lot of times for caregiving, it is a marathon. It's not a sprint. And you have to pace yourself. And part of that pacing is you have to take care of yourself first. That's not being selfish, that's being realistic. Because if you're not taking care of you and something happens to your health, who's going to take care of mom, dad, husband, wife? So you have to take care of yourself. One more thing I wanted to add before we jump into the questions, we were talking about how when you're at discharge, and to ask all of those questions at discharge. AARP was very instrumental in passing what is now called the CARE Act. It passed about 2 years ago, and it is now law in 40 states, including Texas and all through the South. What it does is it requires the hospital to do 3 things for you as the caregiver. Number one, it requires them to put you down in ink in your loved one's medical record that you are the caregiver of record. So it requires them to put that there so that every person who picks up that chart knows you're the caregiver and you need to be informed of everything that's happening. Second thing that it does is it requires the hospital to tell you when your loved one's going to be discharged. So there's no surprises that you're at work and suddenly mom is trying to catch a bus to go home. So it requires them to keep you in the loop, in the communication loop. And then finally, it requires them to show you everything you need to know for the discharge when you get home. If you're going to be doing wound care, they're required to teach you how to do it so that you can do it effectively. If mom's going to need to use a walker, they're required to teach you how to use the walker so that she uses it effectively. Now, understand that not all hospitals will remember this. Everyone working at a hospital is a human being who is taking care of many, many other human beings simultaneously, and they just may not remember to tell you a lot of the things. So advocate for yourself. You know, if they don't tell you the things, ask for them because they're required to tell you. And, you know, they're not going to hide things from you. One of their main goals is to make sure that mom, dad, husband, wife do not come back to the hospital because they get dinged on it financially if that happens. So they're going to make sure that you are armed with everything you need to keep a readmittance from happening. So be sure that you're advocating for yourself. Lina gave you a tremendously robust list of things to ask. Ask them all. You never know, you know, you may think, oh, I don't need to ask this, I already know this. Ask it anyway, because you might be surprised. There's something you didn't even think of that'll come up. So be prepared and make sure that you have all that information ready. Had a quick question pertaining to that. You'd mentioned to go and find the social worker and ask all these questions. Is every patient who's admitted into a hospital covered by the social worker?
I have found that to be true, that there's a social worker for every floor. And they are the ones that are helping. Now it may be a RN, so RN case manager / social worker. So they may not have a social worker, but they have an RN case manager, or they may have both. I know some hospitals have both. So that's why I made the 3 folks to ask who, if they have that. So yeah, more than likely they will have a social worker on each floor.
Yeah.
To help.
And if ever in doubt, stop by the nurse's station and ask.
Yeah.
Or stop by the administration and ask. Lina, I want to jump back to some things we talked about at the beginning with all the items that we need to put into our binder. And had a couple questions about some of the forms specifically. One particular question was about what is the difference between the medical power of attorney and a HIPAA release? Does the HIPAA release automatically allow for the release of information, or do we need to have both the medical power of attorney and sign the HIPAA release?
So the medical power of attorney will allow you to make a decision on healthcare decisions if your loved one, elder adult, or whoever you're taking care of is not able to make that decision for themselves. The HIPAA release allows you to communicate along with other people that are designated to release information to you, to your brother, to your sister, to your aunt, to your uncle, whoever you want to list, or whoever your elder adult has designated as people that they want to have access to their healthcare information. So it's the receipt of information for the HIPAA, but it is the decision-making capacity when somebody is not able to make that decision for themselves. Usually it's 1 to 2 people for the medical power of attorney. And it is only active when they cannot make the decision. Sometimes there's the impression that I have the medical power of attorney, so I can make all the decisions for mom and dad. And that is not true. It's only when they are not able to.
Okay, great. That's great to know. Had another question about that power of attorney. One particular caregiver, their mother is able to verbally give consent for the power of attorney and the medical forms, but she cannot sign them because of her medical issues. How do you, as a caregiver, confirm that you have that power when mom just physically can't sign it? Is there a way of having a witness who verifies?
Well, again, this is part of, in hindsight is 2020. It's always good to have those documents before, because when you get to a diagnosis where you're formally diagnosed with a cognitive impairment, Alzheimer's, dementia, it's already too late to make that, to have them sign or verbally consent, because if they are diagnosed, they're not supposed to be signing. I mean, in the legal world, you're not supposed to be signing that. Now, she may be able to mark her X. I'm not really sure what the limitation is. Is it because she has Alzheimer's?
Yes, that was the note from the caregiver.
Okay, all right. I didn't see that. So, that's a really sticky legal question that, for me, I would like to have all the ducks in a row. I would like to have them, when they have a diagnosis, it's very, very hard to say they can verbally consent, but they can't sign. So do they understand what it is they're consenting to verbally? And do they understand what they're signing? That's a sticky one. So I would consult, there's we have legal resources out there that could answer that question appropriately, where
right.
they can give good sage advice on that.
Yeah, I want to point out that neither Lina nor I are legal experts, nor are we doctors. So there's some things we just can't answer. And so you'll want to consult with someone who is an expert, preferably a elder law attorney, and there are some amazing ones here in the Central Texas area. You can contact Age of Central Texas and we can connect you up with those folks. We also have a lot of resources that are available for those who just don't have the funds to be able to pay for a lawyer because they're expensive. And not everybody can do that. So there are some nonprofit organizations that are legal that can help out with those questions. But that leads to another question that someone had asked, and that is, are there documents that are best handled by the attorney? Say, your power of attorneys, obviously your will, those type of things.
Yeah.
And which are the ones that you can just download right off of the internet, fill them out, and put them in your binder, and you're good to go?
I would say the DNR. The do not resuscitate order that I had mentioned, you do not have to go to an attorney for that. Even a social worker at a long-term care facility or a social worker at the hospital can help you fill that out. It just requires if you are the power of attorney for the elder or of the patient, you can sign on their behalf if you have appropriate documentation. You need 2 witnesses and you need a physician to sign off on that. So that is different from the in-hospital DNR, okay? The out-of-hospital DNR are just for events outside of the hospital, but that can be, you can go to the Texas Medical Association or Google Texas out-of-hospital DNR and print that out and it'll give you the instructions.
And take it with you when you go on your doctor's appointment, doctor sign it, and then you're done.
Yeah.
You're talking about the binder. We talked yesterday in Lori's presentation about binder as well, because that is such an amazing thing that caregivers need to have everything in one place where you can reference it, keep it updated, not have to go searching for things. And especially when you have an emergency, you just grab it and you go. And you've got everything that you need in one spot. Lori had suggested yesterday actually making copies so that you have 2 of them, one that's packed in your bag and then the one that's kept at the house. That way, if for some reason you accidentally leave it at the hospital, they're not going to know what it is. They may throw it away. And that way you don't lose everything that you've got it. There's also a lot of ways that you can store a lot of this information in the cloud if you're tech savvy, that is safe and protected. So you can use Google Drive and a lot of other things that can help you, where you can save them a lot so that you can, pick up your phone and you've got it right there when you need it. But
that's a good idea when you have family members that are across the state or across, the nation, that they can do it. You can access in the cloud, but whoever's an alternate decision maker for the elder adult should have a copy of all of that information, because I have found that a lot of people don't know that they're the medical power of attorney. It's like the parents assign them, but they've never talked about it. And it's like, oh, I'm what? So it's just really good to know that you are designated. Because some people also don't have the bandwidth to do that. They're like, I don't want to make medical decisions. Mom and dad probably made that decision because the birth order was you're the oldest, so you're going to do it. But as we grow into adults, maybe that's not something that you want to do. So you should have that discussion with them as well as your siblings on who could be the person that could be most appropriate to handle those types of decisions, financially and medically.
Right. And often we as caregivers see instances where the power of attorney was given to a particular sibling who now lives on the other side of the country. And mom is here with me, yet I don't have power of attorney, and I'm the one who's taking care of her 24/7.
Yeah.
So, need to talk with the sibling and say, hey, we need to do this legally and have you give me back the power of attorney.
Yeah.
Got a question here about power of attorney. Is there a limit to the length that the power of attorney is in effect? A particular caregiver had it signed 4 years ago before dementia was evident. Now dementia is in place. Does it have a time limit, or is it until it is rescinded?
So my parents initiated theirs in the 90s and my dad died in 2017. Now, would I say that that's a good practice, like have 20, 25 years go by before we look at it? I would say that it needs to be looked at regularly because events change. You may have somebody, that as a, I have a client who's 70, he designated his 70-year-old friend who is now 76, and he may not be around to make decisions for that person. So it's just good to, you don't have to do an in-depth, but kind of this, just annual review. And it's just good practice just to make sure that everyone that's assigned is able to still execute on what they're supposed to be doing.
Right. And again, if there's any doubts on anything, consult an attorney, because these are binding legal documents. And, you want to make sure, like Lina said, have your ducks in a row. You don't want to find out when you're at the hospital emergency room, that things are not what you thought they
Yeah.
were. That's
Yeah.
not the time to be panicking over something
Yeah.
like this. Got some questions about the information on pharmacies. You had mentioned the pill packs, that is an Amazon company that you can order them online. And you mentioned the blister packs. So just to clarify for one person, is what you can get from your local pharmacy is either in the bottles or you can get the blister packs.
Blister pack,
If you
yeah.
want to do the pill packs that come where everything is in one pack, that's something that you order from
That's-
a particular
That's
company.
Amazon pill pack, yes.
Okay.
Yeah.
All right.
Mhm.
So there you go. There's your answer. On your slide also, when it was talking about mail order, it said that Medicare and mail order go hand in hand. Can you expound on that just a little bit?
Well, you can, so if you're a Medicare Part D and through your through your pharmacy or through your provider, you can actually sign up like for Omnicare or Express Scripts, and they will accept your Medicare Part D. And then usually they like to do it 90-day fill. They don't like to do the 30-day, which I think is much better. So if you have that, you can utilize those services. It's just more of a convenience factor for our homebound clients that you can do mail order, and then but now the pharmacy world has changed, so you can go to CVS now and do that, because now everybody's doing delivery, so you don't even necessarily have to do mail order.
But either way, mail order delivery, it's very, very convenient, especially
Convenient now.
if you're the
Yeah.
caregiver, not having to make that trip to the pharmacy is
Yeah,
really.
especially during COVID, they would just they just deliver it. HEB would just
Yep.
deliver it, and everything's good to go. Even Terrytown, our local pharmacy, Terrytown will also deliver.
Yeah, I personally live out in Maynard, and our pharmacy does the same thing, and they keep track of the refills and everything. So it's fantastic. It helps us immensely in our caregiving journey. Got another question about the meds. Is it possible, let's say we've got an emergency, we've got to run to the hospital, take mom to the emergency room. Can we take her meds with us for the hospital to give to her, or is the hospital not going to accept those medications?
Wow, that's a good question.
Yeah.
Well, I think you know what? I don't have the answer to that. And that is a very good question that I'm going to look up. But in the effort to be overly cautious, I would take those medications. But I will find out what the hospital protocol is to see and get that answer for you. And thank you for asking that, because that is a really excellent question. By the time you admit them, and it might be past their dosage and they haven't taken their meds, I could see how that could be impacting their health.
Yeah. Every hospital is different, so they may have different rules.
Mhm.
One person just chimed in and said, when I was in the hospital, I couldn't use my own meds. And so, but it's always a good idea to take it with you anyway, because they may be able to take them themselves, or more importantly, be able to show the charge nurse, this is what she's taking, and
because I could see a scenario where somebody has extreme anxiety, and of course now you're in an anxious environment where it's causing even more anxiety. Are you going to wait till they administer? So I would see how that would be like, what, I have your whatever medication you're taking to alleviate that that anxiety that's occurring. So I could see where that's so important, and I will get the answer, because now I'm intrigued.
Right. As we said, if we don't know the answer, we'll find it out for you and we will let you know. Got another question here, and this is something we actually talked about yesterday, is mom has dementia, dad is caregiver, dad's starting to slip on taking his meds, but he will not let us put the meds in the pill packs. No, I can still do it all, fighting tooth and nail against doing what needs to be done. We need a system here. Let us help you. Let us fill them, all of that. How do you convince someone who doesn't want the help? And as I know, a lot of times when you've got clients in your home health care that the daughter sets up the appointment for you to go and take care of them, and they're like, I'm not having this, get out of my house. How do you handle someone who is just refusing the help that you know they desperately need?
So honesty is always the best approach. Sometimes you have to come to a reality conversation. Now, every dynamic, and we always treat our elder adults with dignity and respect, and approaching them in a very respectful manner. But I confer with the children first to see, what the situation is that's been happening. But here's also the other side of it, which you probably don't want to hear, is that our parents have a right to decide their healthcare journey. And oftentimes it is not in alignment with what we have in mind. You have this role reversal now where you're becoming more of the parent and they're becoming more of the child. However, oftentimes our clients painfully have to sit back. The adult children have to sit back and allow their parents to do it because you're fighting. It's just not working. They just want to do what they want to do. You get very frustrated, but you have to prepare yourself for the event because it's not, when not if it's going to happen, it's when it's going to happen, and be able to have a plan in place to deploy. Now, that is not a perfect answer. It's probably one that you don't want to hear, but it is also the reality of the situation. On the other side of that, when we come in as care navigators, and talking, sometimes they like to listen to us and they don't like to listen to their kids. And I don't know what the reason is. It's like their kid is not going to tell them, but if a professional nurse or social worker comes in and they're like, well, yeah, okay, we'll do that. And they said, how did you do that? It's like, well, we just talked about it. And, it's a little different when there's a child, adult. It doesn't matter how old you are. I'm 55. My mom still makes me feel like I'm 10 sometimes. So it's just the reality. And sometimes you have to just sit back and prepare for the event, or get a third party in there, and have them talk to it, because sometimes receiving that information is much more palatable to them than having their child tell them, even if the child is in their 50s, 60s, or 70s. And that's
Exactly.
Just
Yeah, a lot of times utilizing that third party is the way to go. Somebody that they will listen to and they trust. If they are a person of faith, talk to their minister and get them to bring up the subject with them personally.
Or leverage the doctor. Sometimes
Exactly.
the authority
Someone
of the
wrote in about
doctor.
that, and we had to do this personally ourselves.
Yeah.
That we got the doctor, took the doctor's side and said, okay, here's what's going on, and here's what we need you to do. And we need you to tell this person in the family, this is what they need to do as part of their medical advice.
Can I add something there really quick, Rob, on there? So I just wanted to say that when you are going to a doctor's appointment, because they're probably about 10 to 15 minutes long, my suggestion to you is just in a strategy to utilize that time effectively, because a lot of times elder adults don't like to be talked about in front of the provider, like mom's losing her memory or dad's doing this, or write a note and fax it before you go into the appointment. And bring that note with you so that when you are doing the pre-paperwork to sign in, that the doctor has that. Because then it avoids having to talk about the issues that you're seeing as the caregiver adult child. And it doesn't make them feel uncomfortable, like they're being talked about, like there's something wrong with them. And then you can maximize that time so that the doctor and you are kind of on this covert plan to address the issues. It has saved a lot of time, and you can manage that time effectively. A lot of us hem and haw when we're going in the doctor, like, mom, she's a little bit this and a little bit that. But if you have that, that little note of your concerns before you go in, it makes it a lot easier. And it relieves you from a lot of awkwardness in that doctor's appointment.
Right. Like you said, you always want to be respectful of your person that you're caring for. Even if they are in late stage dementia, you're still very respectful of them as a human being, because they are still a human being. And so, don't talk about them in front of them. We personally, I was the one who did it, said, I'll meet y'all at the elevator. I want to ask the doctor a quick clarification about something that he said. And as soon as they were out of earshot, I said, okay, here's the deal.
Yeah. Yes.
And I need you to be the one to say, you can't do this, because they'll listen to you. They won't listen to us. If
Right.
it comes from you, then now it's medical truth
Yeah.
and it has to be done. So, in the case of, with the prescriptions, something as simple as asking the doctor, will you write a prescription that they have to have a pill bottle, a pill organizer, and that, the daughter has to fill it every week, something
Yeah.
like that,
That
because
empowers you. Yeah.
yeah,
Utilize that authority figure in their
right,
life, who they listen to, because what do we know?
right,
Uh,
right. Um, a couple of things that we discussed yesterday with being prepared with your bag for going
Mhm.
to the doctor. One thing that I personally have seen very effective is to always carry with you a jacket or a sweater in the car,
Mm.
because sometimes your loved one will have an accident. And so, as not to embarrass them, you can wrap that around their waist if you don't have to change clothes, especially if you're out at the grocery store or somewhere else. So that's always a good thing to add to the bag. Sometimes the hospital is cold, you might want to wear it, but
Yeah.
that's something, a good thing to have with you. Another thing we talked about was in your binder, have a list of your loved one's likes and dislikes. You talked about having that photo or that item from home that kind of helps with the anxiety, because they can see that, and
Mhm.
it makes it more comfortable. But having that list of their likes and dislikes is something that you can share with the charge nurse. And so if they know dad really likes watching old Westerns, if you've got to go somewhere for an hour and do something, they know they can go put the Westerns on the TV and dad's going to be happy while you're gone. And so it just helps them in giving better care, which is their entire goal.
Yeah.
And so that's usually something else that is good to have. Got time for one more question that's come in, and it's a question about medication problems. Caregiver writes, my mom went into rehab after surgery with severe post anesthesia issues. She needed antipsychotic drugs, and the ambulance took her around 8 p.m. I was told they had scripts for the meds. When we got there, they had no drugs to utilize. Their pharmacy was closed and didn't have anything till early in the morning. My mom was off all night in a wheelchair, slamming into doors, trying to get out of the hospital. How can I make sure that the meds go with her next time with the ambulance? I'm going to assume that this is someone who was not there at the house when the ambulance came. So if you get the call from the hospital that your mom is being transported, what are some things that we can do if we're going to have to meet them at the hospital that we can be prepared for?
Was she coming from the home? Wait, my mom
It
went to,
was not specified. So I'm
oh,
going to assume that mom was living independently to
mm,
some degree, and I'm caregiver of record. I got the call from the neighbor, the EMS is taking your mom to the hospital, and so I had to meet them there. If I'm not there when something happens as the caregiver, what do I need to start thinking of, A, B, C, D, that I need to do so I can get to the hospital and be prepared with everything that I need?
wow. That
And
is
that's a lot to unpack.
a lot to unpack. Yeah, it is. And I could see where, and I'm sorry that she had to go without medication. So she needed to get the antipsychotic meds. Hmm. That would take some thought. I don't, were the were the meds not ordered? I'm trying to get a handle
By the
on.
time they got to the hospital, the pharmacy was closed and the hospital did not have access to that specific med.
Okay. Well, as a care manager, I would be, we would find alternatives. Now, from a professional perspective, I would be calling every pharmacy to see who could fill that medication. Where the gap was, that's where, I'm trying to identify where the gap was, in the ordering of the scripts. As she was coming home, and those should have been in her bag, ready to go. But if she was living independently, it's hard for her, if she's in an event, to say, let me grab my bag. Perhaps the caregiver needs to have a small supply of her medications with her, so that when she goes to the hospital, she has that, if that's applicable to the situation, if I have the sequence of events to of what she was explaining here, but maybe she needs to have a small supply of her own, of her mom's medications with her in the event that something happens, along with her medication list. That might be, you know, to fill
Yeah.
the gap temporarily.
We'd also talked about having your documents somewhere where EMS can find them very quickly, you know, take to the refrigerator or something
Yep.
like that. Perhaps
Yep.
just a note in big letters saying, you know,
DNR.
mom needs
Yeah.
this to go with her.
Yeah. Yeah.
And, you know, we never know when these things are going to happen. And like Lina said, it's not the if, it's the when that you're going to have these incidents as a caregiver. And so having to second guess a lot of it is difficult, but sometimes being over prepared is the best way to go.
Yeah. And there's 1,001 scenarios, you know, every time I
Yeah.
participate in one of these conferences, it's like, oh my goodness, I didn't, you know, those are things that I didn't think about, even in the bag, like, you know, the blanket to wrap around, you know, you just always add. So again, it's just an encouragement to keep on attending and educating and looking for resources and having dialogue, because caregiving can be a lonely journey too. You don't think other people are going through the same thing that you're doing, but you'd be so surprised when you start talking about it. And, you know, there's not, you know, it's sometimes you think, is this a badge of honor? But it is a badge of honor, and it's difficult. So it's okay to talk about it, but you will find more people are caregivers and that you have more in common with if we just continue to have the dialogue and participate in conferences and, you know, seminars like this.
Right. And that's also a good wrap up for us here. You know, everybody's journey is different. But there are a lot of commonalities that we all have as caregivers. And one of them is that we feel very lonely. And that's why Age of Central Texas exists, is to help you in that journey. You are never alone. And there's never a shame in asking for help, because all of us need it at some point in our life. And that's why we're here. And so we want you to call us and ask for that help, because we're here to provide it for you. And we hope that you learned some things today that you can take with you in your journey. We've got 2 more great sessions. Yesterday's session is downloading right now. We're going to put that up on YouTube very soon, and you'll have that to access as well. Also, remember, Age of Central Texas has support groups throughout all of Central Texas. Most of them are all virtual right now. And so anywhere that you are, you can join into those. And being able to just unpack with another caregiver who's sitting there going, yep, me too, is just so helpful. And as other caregivers can give you suggestions to help you in your journey of things that worked for them. So we want to thank you so much for joining us today. We want to thank Lina, especially, for taking the time today to share all of your expertise. It's always a joy to have you participate in all these great conferences. And we want to thank you, the caregiver sitting there at home watching this, because we know this is a really hard journey for you. And it's very emotional, and there are so many things that happen. And again, just always remember, you're never alone, and we're here to hold your hand and to help you through it. So we hope that you have a wonderful rest of your day. We hope that you join us again tomorrow and then again on Friday, and we will see you later. Have a great rest of your day.
Bye. Thank you.